Nursing informatics history. 7 time periods. Prior to 1960s, computer industry grew. Nursing also made major changes. Computers are used by healthcare facilities for basic business functions such as punch cards, card readers, and teletypewriters. 1970s, nurses began to see the value of computers in the profession documentation of nursing practice, quality of patient care, repetitive aspects of managing patient care. Computers are perceived as cost-saving technologies. HIS further advanced computer-based MIS and public health developed. 1980s, nursing informatics emerged. Need of data standards, vocabularies, and classification scheme for computer-based patient record system identified microcomputer or personal computer emerged. Has brought computing power to workplace, especially in the point of care, served as a standalone system, user-friendly, and allowed nurses to create their own applications. HIS emerged with nursing subsystems, order entry, result reporting, vital signs, and narrative nursing notes. 1990s, computer technology became an integral part of healthcare settings, nursing practice, and the profession. Nursing informatics was approved in 1992 by ANA as a new nursing specialty. Demand for NI expertise increased greatly. Use of innovative technologies for all levels and types of nursing patient education demanded. 1995, Internet was brought to social milieu. Email, file transfer protocol. The Internet was used to exchange data between CPRs, while the web became the means to communicate online service and resources to the nursing community. 2000s, a change occurred in the new millennium as more and more healthcare information became digitalized and newer technologies emerged. In late 2000, a hospital became paperless. They began employing new nurses who had never charted on paper. 2010, a historical analysis of the impact of the nursing minimum data set demonstrated that a continued consensus and effort was needed to bring fruition the vision and implementation of minimum nursing data into clinical practice. History of nursing informatics in the Philippines. The Philippine nursing community have long sought to keep up with the increasing use of information and technology in the healthcare system. Nursing informatics follows the footsteps of biomedical informatics, which has gained relatively popularity earlier than its other allied medical counterparts. The word nursing informatics were unfamiliar among the nursing community until the year of 2008. There were only a handful of people with knowledge and experience in nursing informatics, but the discipline have not yet found its recognition as a subspecialty of nursing arts and science in the country. The origin of this budding discipline indirectly came from the pioneers of health informatics in the Philippines. The Philippines Medical Informatics Society and its founders had strong influence in the development of health informatics in the Philippines. The PMIA was officially registered under the Securities and Exchange Commission in 1996 by its board composed of 11 physicians. The organization was headed by Dr. Alvin Marcelo. Since 1998, several faculty members of the University of the Philippines began formal education and training. Dr. Herman Tolentino took a postdoctoral Fellowship in Medical Informatics at the University of Washington. Dr. Alvin Marcelo followed a year later for his training at the National Library Medicine. Dr. Cito Marambra went to Coventry for his Masters in Informatics on Sciences at the University of Warwick. They were later followed by the other physicians such as Dr. Michael Muin and Dr. Ryan Barnes. By the year 2003, a Master of Science in Health Informatics was proposed to be offered by the UP Manila Colleges of Medicine, major in Medical Informatics in the College of Arts Science, major in Bioinformatics, and was later approved to be offered starting academic year 2005 to 2006. In 1999, a study group was formed headed by the National Institute of Health of the University of the Philippines, Manila. This group identified international standards for health information and their adaptability in the Philippines. They were joined by founding members Mrs. Cheryl Okia, a graduate of Master of Science in Nursing major Nursing Informatics at the Xavier University, Mrs. Alexandra Bernal, a graduate student and telehealth nurse of the National Telehealth Center, Mrs. Pia Pelayo, a former telehealth nurse and a project coordinator of the National Epidemiology Center, Department of Health, and Mrs. Sid Cardenas, also the telehealth nurse. Other founding members include Mr. Noel Banez, Mrs. Rona Abisid, and Mr. Harvey Ongbay Abelañosa.